Well, this to remind everybody of the anatomy is the bile duct and the pancreatic duct. And it's the obstruction of this with, for example, a tumor that then results in the bile backing up and jaundice. And there's many ways to deal with this. And what we're doing here is placing a stent. And so this is the plastic stent going into this bile duct to relieve the obstruction. These are small. These are a little bit smaller than a regular pen in size. They come in all different shapes and sizes. And then once that's in, it's relieving this obstruction and then getting the bile to flow again and relieving the jaundice. So when a patient has an ERCP with a stent placed, this is essentially what's going on. So the other endoscopic test that we use very frequently is an endoscopic ultrasound. And essentially what this is an ultrasound camera attached to a regular endoscope. Here's a cartoon figure of it with the ultrasound camera sitting in the stomach, and you can see we're very close to the pancreas, and so we're able to get great images of the pancreas. This is the same type of ultrasound camera that would be used during a regular abdominal ultrasound that I showed you earlier, but now we're able to get deeper, so we're actually able to get much better images of the pancreas. This is what we end up seeing. We get these very clear, crisp images of different regions of the pancreas. We can see the head of the pancreas well, we can see the body of the pancreas well, we can see the tail of the pancreas very well. In addition, we can actually see where the blood vessels are as well using Doppler technology that comes with this endoscopic ultrasound, such as this. So we're able to light up blood vessels and avoid them. But the biggest advantage of this technology is the ability to stick a needle and biopsy anywhere within the pancreas. So to avoid those CT-guided or what are called percutaneous biopsies. Other additional things that endoscopic ultrasound can be used for include palliation of pain with nerve blocks, and this is very effective in patients with pancreatic cancer who are on lots of medications for their pain, with a view to getting them off those medications and cutting down on the side effects. Another procedure that we've been asked to do more and more of is really to help those who include radiation therapy in their treatment of their patients. And with these new kind of buzzwords that are out there like cyberknife technology and stereotactic radiation therapy, the radiation oncologists want to know exactly where to direct their beam of radiation to focus on the tumor and avoid damaging normal tissue around it. So what we do, we place what are called fiducials. These are small gold fiducials. This is a cent. So these are the size of the fiducials in relation to it. And they're delivered under endoscopic ultrasound guided needle delivery right into the pancreas tumor at the edges. They give the radiation oncologist an idea about exactly where the tumor is when they're planning their radiation therapy. So that's really where we are currently with the different diagnostic tools and algorithms that we use.